The signal to go here. So welcome to our vibration conference, and we're pleased to have you here. My name is Richard Wells. I'm director of the Center of Research Expertise for the Prevention of Musculoskeletal Disorders, more easily known as CRE-MSD. And I'm happy to also note that our conference today is sponsored by two sister centers, CREADA and CROSH, and I'll introduce those centers just a little bit in a few minutes. Vibration-related injuries are an important class of injuries of MSDs, and our goal today is to give you a little sense of health effects, but that's not our main goal. Our main goal is to talk a little bit about how you would go about assessing risks, either yourself or through hiring a consultant or other people to do that, because it does require, as you'll see, technical equipment. But then to have a look at the current controls for vibration. And we have a couple of sessions this afternoon where we're going to do that. Finally, we're going to end up the day by having a more general overview of vibration and vibration-related injuries and their controls, and how we can put that into a bigger context rather than the details of an individual machine or situation. So that's our day, and I hope you'll find it interesting. I'm never sure whether to call these conferences, which it tends to imply more of a sitting, or workshops where you actually have to work. So we have a little bit of both. So you should have plenty of coffee so that you're ready for that, especially after the break. Before I continue, though, I'd like to have Scott Campbell from the Ontario Ministry of Labour welcome us. And Scott's the manager of specialised professional services, and he provides leadership to an interdisciplinary group of engineers, ergonomists, and hygienists. And he's also manages the MOL Emergency Management Program. So I'd like to call on you, Scott, to welcome us and give us a little bit of a context for today.
Well, welcome to the workshop. I'm pleased to be able to come and speak today a little bit about the Ministry of Labour, and to welcome you on behalf of the Ministry of Labour. It's a unique opportunity to, as Richard was saying, to do a little bit of work together and do a little bit of learning. So the Ministry of Labour's goal is a safe and healthy workplace, and the people in the room are probably no doubt dedicated to that same goal. Specifically, though, with the vibration, we recognize it as a cause of both musculoskeletal disorders and occupational disease. So what I'm going to do is talk a little bit about what's coming, and then reflect on what we've done as a community to reduce the musculoskeletal disorders. Unfortunately, our statistics don't go down deep enough to pull vibration out specifically. So if it's a little bit general into the MSDs, then that's particularly wise. It was either last quarter or the very beginning of January of this year, the Ministry of Labour's prevention branch rolled out a new integrated health and safety strategy. This came about from the Tony Dean report that recommended that the Ministry of Labour needed to collaborate through the whole system and pull together the pieces to put together a comprehensive prevention strategy. So with the integrated strategy has 6 priorities. 3 of them are on the prevention side, 3 of them are on the integration side. particularly for the MSDs and vibrations, are recognized as a high hazard in that they're a significant proportion of the injuries that are suffered in workplaces in the province. And so within the 6 priorities, it falls under the high hazard. So in order to address the 6 priorities, there's 7 approaches that have been identified. In this case, for today, with the MSD and vibration, we're looking at approaches that include awareness, education, collaboration, and research are the most applicable approaches for addressing these issues. In particular, with today's talk, we'll be looking at you'll be looking at some of the research with the opportunity to collaborate with one another. And what comes from research and collaboration is innovation. I spent 18 years in research and development in metallurgy, and that was always what led us through breaking points of our research, was the collaboration and the innovation. What comes about from the innovation and the research is evidence-based analysis and evidence-based use of control options. These options are then are supported by or validated by the research and become acceptable practices within the workplace. So through this, we're looking to improve the prevention of vibration-related MSDs and occupational disease. Taking a moment to look back ever so briefly, was in 2006 was the initiation of the Pains and Strains campaign. Since that time, we've had a 41% reduction in the MSD claims. We've had a 61% decrease in the total loss of working days, and a 47% reduction in direct WSIB costs. I think those are showing some of the right statistics going down and are fairly significant. The goal moving forward is to continue to drive down the numbers of injuries and costs. And one way that we look at doing that is by having the right people with the right information at the right time to ensure we have an opportunity to prevent the injuries from occurring. So, instead of me talking much more, I will allow the workshop, Richard, to get the workshop off, and thank you once again for allowing the Ministry of Labour to open the conference.
Thank you. Thank you, Scott. Thank you, Scott. In the same vein, I'll move us quickly along because I'm not talking much, which is great for both of us. So just to move just a little bit ahead and just describe our centres, because as I say, this is a collaboration of 3 centres, which is a great move forward. So I mentioned that I'm director of the Centre of Research Expertise, and as you know, we are funded, as is CRE-MSD, by the Ontario Ministry of Labour. And so I'd also acknowledge Lynn Holness, who will be coming up in a moment to introduce one of our speakers, and also Tammy Egger, who is also one of our speakers, who is the director of CROSH. And so this is an interesting topic in that it intersects with many of our interests, occupational disease, MSDs, and so it makes perfect sense to collaborate on this, and I look forward to collaborating on yet further topics. Before I kind of go through the day, let's just get a sense in the room of why people are here. So, how many people deal with vibration-related problems frequently in their work? Okay. How many people deal with them occasionally? Okay. So it's one of those things that you run across now and then. How many people have been involved in measurement or assessment of vibration, either whole body or... Okay, good. And I think that there's a number of people here who actually do the knobs and dials and switches and stuff. So we'll also be using their expertise when we have some breakout groups. So the point I think of today is to go a little bit deeper than perhaps we normally do and say, well, what is this thing called vibration measurement? And if you do have someone, one of your colleagues or a consultant come in, what should you be looking at? What are the numbers? What do they mean? What are the assumptions? And then how do you take those numbers, take one of the standards, and come up with some interpretation and some conclusion about what you might need to do. In the afternoon then we'll take that as a jumping off point and say, okay, what are the controls that are available? And we're going to have a presentation on those types of controls in general, and then we're going to ask you to take the information both from the worksheets that you're going to be working on in the morning and the control information and come up with a set of controls that you would like, as well as their pros and cons, because we'd all like the Cadillac, but sometimes I don't know what the phrase is. It used to be the VW, but I don't think that counts anymore, the VW Beetle of the controls. And lastly, as I mentioned, we're going to have a panel with some of your colleagues and the speakers to try and take questions and provide a bit of context and the close for the day. So that's where we're heading. We've got a really great bunch of speakers, and I'd like to briefly introduce them because we're going to see them pretty heavily during the day. And so our two major presenters here today are, first of all, Ron House. If you could wave your arms, Ron. Where's Ron gone? Oh, good. Thank you, Ron. So Ron House is a specialist in occupational medicine at St. Mike's Hospital and a member of CRE-MSD, Center of Research Expertise in Occupational Disease. So he was in an occupational medicine residency program and the director there at the University of Toronto, 1995 to 2012, and an associate professor in the Dalla Lana School of Public Health. And as we might expect, one of his main areas of clinical and research interest is hand-arm vibration syndrome. So Ron will be sharing with us not only his expertise in the health effects, but also in the exposure and the control sides. Our other presenter that I'm going to introduce is Tammy Egger. So if you can wave there, Tammy. And Tammy's an associate professor at Laurentian School of Human Kinetics, and she's also, as I indicated, the director of the Center of Research in Occupational Safety and Health in Sudbury. So her research interests focus around application of ergonomic and human factors principles in industry, and much of her current research work involves assessment of vibration exposure, but as well, because we have an extensive mining sector up there, but also line of sight in heavy vehicles, posture, musculoskeletal injury risk in the operation of large industrial equipment. And so Tammy will be bringing her extensive experience in measurement and in controls in that environment from the north. Our other guest, which I'll be asking Lynn Holness to introduce in a moment, and I'll ask Lynn Holness to introduce Adil in a moment. So before I do that, I'll just introduce Lynn Holness. She is the director of CRE-MSD, and so a sister organization. So if you could just come up for us here a minute, Lynn, and introduce our last speaker. Not our last speaker, another speaker.
Thanks, Richard. So I'm delighted to be able to introduce Dr. Anil Adisesh. And Anil, you can wave there. You'll hear him later in the day. He's going to do a formal presentation, but hopefully he'll also ask questions, provide comments as the day goes on. Anil is the J.D. Irving Limited Research Chair in Occupational Medicine at Dalhousie University, at Dalhousie Medicine, New Brunswick in St. John. And he's a specialist physician in occupational medicine at St. John Regional Hospital, Horizon Healthcare Network. Anil studied medicine in the UK at the University of Liverpool. He started in family medicine, but very quickly became interested in occupational medicine, so went on to train at Guy's and St. Thomas's Hospital in London, and then at the University of Manchester, completing both a master's and later a doctorate degree in occupational health and safety. Relevant to today is from 2004, Anil worked at the Health and Safety Laboratory in the United Kingdom, and he led the HAVS assessment clinic at the Health and Safety Laboratory and trained over 1,000 physicians and nurses at HAVS assessment. So Anil, we are really fortunate in having with us today because he's going to bring a perspective from the United Kingdom specifically, but also Europe more generally to help inform our conversation. Just to let you know what his activities at Dalhousie, you've been there for less than a year, and he has the challenging tasks of, first of all, developing training for undergraduate medical students at Dal, also developing training in occupational health for postgraduate students, as well as setting up a clinic to actually see, assess, and help workers who have occupational injury and disease. So he has a very large agenda in St. John, and we're delighted he agreed to join us today to, as I say, bring a perspective from the United Kingdom and Europe. So welcome, Anil, and we look forward to your contribution over the day.
So thank you, Lynn, and just welcome our three speakers. So I invite you to visit the websites of our three centres, and as I'll indicate in a moment, we will have information about the conference for you on those. So, stepping through the day, what are our objectives here? So, building awareness and knowledge of vibration risks and health consequences. As I indicated, certainly the health consequences piece is one we're interested in, but our focus will be more on the vibration risks and controls. We're looking at providing practical advice in terms of what the heck these reports are, what they mean, how you might measure it, and how you might work with one of your colleagues or a consultant. We also provide some resources. There are resources both within the package that I'll get to and on the web that can help you in assessment and control of vibration. And to demonstrate and discuss the prevention activities and what is good practice. I don't know what is the best word here, certainly not best practice, but some practice, and certainly good practice is a good start. And so we're going to start out, when I finish and shut up here, with talking a little bit about the first point, which is why is vibration important and how is it assessed? We have, fortunately, actually, a new speaker who came through for us. And due to our confusing communications, was actually raring to go, but we didn't know it. And so we'll introduce him in a little while. And so we're going to actually have a three-part presentation around why is vibration important. After the break, we have a slight change there in the schedule. We're going to actually then move into two connected sessions, both on whole body vibration and on hand-arm vibration. We're going to be taking this parallel track throughout the day with both kinds. And those are going to take the form of case studies. And those case studies are available actually in your package. And so you will be working with those pretty heavily over the day. That'll take us up to lunch. And by that time, you'll have got a report that you've helped create with the aid of speakers. And at that point, you'll be in a position to decide what you might need to do. Are we in a situation where we need to instigate controls or not? Then after lunch, we're going to have, as I indicated, a couple of presentations on controls, both for hand, arm, and for whole body. And then we put you to work again, because you'll certainly be working throughout the morning, creating these reports, to look at how do we integrate what we've learned in the controls and their positives and negatives, to come up with controls for our two situations, our two cases. Then at the end of the day, we're going to sum up with a more broad overview of the prevention approaches and a panel discussion. And we have three of your colleagues who are going to join the speakers to provide commentary and take questions from you. And we aim to have you out of here by 3:30. And I was going to say beat the traffic, but that's never possible in Toronto. So that's what I wanted to indicate. A couple of details. You'll notice on the boards here the password for the Wi-Fi here at CHSI. Within your packages, we do have some information about CROSH, CRE-OD, and CRE-MSD. We have the two case studies that you'll be working on. And we also have two handy-dandy laminated fact sheets, both one for hand-arm vibration and one for whole-body vibration. And we've laminated them so you can't possibly throw them away. You can use them as a handy-dandy resource. You can use them as table mats. But whatever you do, don't lose them, because I'm sure they'll be useful to you in future. So what I'd like to do now is to move into our next section, which is talking about why is vibration important and how it is measured. And I'll get that up on the screen, and not sure which of Tammy. Okay, you're going to tag team? Okay, so who's tagging first? I am. Okay.